Okay, very good morning to everyone. So hope to see you all again. Today we have quite number of questions, but before that I will go through simple slides about one product. Today we will talk about Cordypine. Okay, Cordypine. So let me share the slides for you all. Share screen. Okay, share screen. Okay, can you see the screen?
Can, Doc.
Can I make it larger? You see, there's a people in the waiting room. Can somebody activate it? So admit on. Okay, so today we're going to talk about, we see a small little bit about Cordypine, because Cordypine is a very powerful product in our DXN products, and it's very helpful in a lot of type of problem and diseases. Okay. So when we go through about Cordypine, okay, Cordypine is actually used for absorption in the colon system, especially for the digestive system. The main reason of the problem of everybody got diseases actually from the digestion system. It doesn't matter a colon problem, cancer, or gastric, or what you call this liver issue, pancreas issue, spleen issue. If you talk about some other things like other problems, skin issue, actually everything is started from the colon system. That's why diseases start from the colon system. We have to make sure the colon system is up to date. So when you see this Cordypine playing a big role in balancing the colon system at all. Okay, that's why it's very, very important to understand the colon system. So Cordypine in one of the main product enzyme to balance the overall system in our body system. Overall system, can liver, kidney, spleen, pancreas, small intestine, large intestine, stomach, mouth, everything. It's playing a big role in our system. Cordypine is a marvelous product. They have treated using so many diseases using the Cordypine. Okay, so we go on. Very fast already. Okay, so you see, this is our small intestine. That's called a wireless layer, capillary. In the wireless layer, you can see the blood vessels, artery, vena, all this blood supply vessels. Okay, and there's a lacteal, and also it's called a wireless small structure of a small intestine. Inside our small intestine, lot of small kinds of this carpet type of small wireless layer in that. This is the actual powerful layer that absorb our nutrient towards the bloodstream. Okay, so why enzyme is very important? Cordypine is a very powerful enzyme. We need to use enzyme as much as possible because the digestion system need enzyme to work. Okay, so we need a digestion system, respiratory system, and metabolism system. We need a proper enzyme to balance the digestion, respiration, and also metabolism. A lot of people, when we don't have this kind of a three type of this problem, we don't have the balancing in this area. That's why a lot of we can call it diabetes happen, kidney problem happen, and some other things also happen. Okay, so to have the good health, you must have a good digestion system and good absorption system. So to maintain the good absorption and digestion, you must have a proper enzyme. That one you can get from Cordypine actually. Okay, so why we need enzyme? See, when we have see a lot of pollution surrounding our area, and enzyme is very important because they're using what you call fermentation process. Okay, so when we don't have enough proper diet in a daily life cycles, we don't eat in the right time, we don't eat in the right format, we don't munch, we don't use our saliva for munching, and lot of mistakes day by day, every day we do. So the food that we eat cannot convert it to enzyme. Whatever we eat, the food is processed into the stomach and fermented naturally in the stomach, and also that it goes to a small intestine and absorption to the bloodstream. All the nutrition has been changed and absorbed into the bloodstream. So when the nutrition transfer from the small intestine towards your blood stream, it goes back to your spleen and liver to convert into nutrient. So when it convert to nutrient, you can see lot of enzymes, lot of vitamins, mineral, amino acid, everything is converted into a food to supply towards the cells in our body. When we send them, send all the correct food to the system, we will see our body is become more energetic and more healthy. Okay, so that's why we don't need to worry about sickness. We just to worry about, did I get a good enzyme daily? That's the important part that you need to think. Okay, now you want a good health, you must make sure you have a good enzyme daily, not a good food, not the tasteful food that we think, I want a chicken biryani, I want this KFC, that is taste only, but you don't have enzyme in that. By drinking a carbonated drink, you don't put any enzyme into the body. You are damaging the body. You are reducing the enzyme from the body. By eating too fast, you're reducing the enzyme in the body. By eating never much, you're reducing the enzyme in the body. You need a proper enzyme to make sure your digestion is completed. Okay, so why we need the enzyme? If we don't have enough enzyme, okay, we can get sick. Always people got like a running nose, a fever. Okay, people who have smoking and alcohol addicted, okay, then the lungs problem, all these things need to be repaired. You need to repair the cell, you need a proper enzyme, otherwise you cannot repair the cell. That's why using Cordypine, we can repair the cell back into a normal condition. Okay, so that's why it's very, very important to have a proper enzyme in a daily lifestyle. We eating lot of processed food, lot of processed food, lot of burnt food. Burnt food is reduce the enzyme that indirectly has in the vegetables. So that's why we need to have a half boil, a 3/4 boil food. Taking lot of meat, actually you are reducing the enzyme. You need a more enzyme to digest the meat. If your enzyme in the stomach is less, your meat won't digest it inside your enzyme. So it takes long time to digest. That's why enzyme is very important in your life cycles. Okay, when you have a lack of enzyme, your digestion system is not function properly. You always have a stomach pain, gassy, all these things, and you also have headache, no appetite, all your bone, joints all get pain. Acidic will increase, acid hydrochloric will increase, because when you don't have a proper enzyme, okay, when the body cannot provide a proper enzyme to the digestion time, okay, the food is not digested, end up the food is spoiled in the stomach, and indirectly acid hydrochloric highly utilized into that food, end up to break the food, not digest the food. So you are demolish the food, not digest the food. That's why you need a proper enzyme to demolish to digest the food. Okay, so when you have a proper enzyme to digest the food, you will have a good system. Okay, okay, when you don't have enzyme, you take more time to digest the food. When you have enough enzyme, your food very fast digested. These are two different things. Okay, so from where we can get the enzyme? Enzyme is creating by the body by itself, by eating natural fruits, vegetable, that highly ripened fruits. okay, highly ripened fruits. When the fruit is fully ripe, okay, you will get an enzyme into that. And also you can get the additional enzyme. You can fermented the fruit and you can get the more enzyme. So ripened fruit, let's say you got 100% enzyme. When you fermented that fruit, your enzyme level become 200% increased. So that's why from eating a normal fruit, you enzyme it, you ferment it, you will get uh, more enzyme fruits. Okay, more enzyme than others. Okay, so enzyme is a very important for the digestion, where you can get from the food that you eat. Okay, what type of food? You must make sure that food you eat is very important, especially fruits, vegetables, not fully cooked. You don't get any enzyme from the from all this meat, all these things. No enzyme. Sorry. Okay, you only can get from the fruit, and also can balance it. Okay, and when you have a proper enzyme, you also will have better, what do you call, a better digestion. Your weight level also will become better, and metabolism become more important, more better. Your digestion, metabolism. Okay, so your energy level increased. You improve in your performance. So these are the important things that you must understand. Enzyme is very, very important in our daily life cycles. Okay, so enzyme help our body, our food, to convert into nutrient that needed by the food. What kind of nutrients are changed, is converted when you have a proper enzyme in our body? Vitamins, minerals, amino acid, micronutrient, macronutrient, natural pigments, and natural carotenoids. These are the nutrients that need a lot of enzyme to prepare towards your body cells and towards your system to make function properly. Okay, this is your digestive system. We eat the food from your tongue. Okay, from the mouth, it goes through the tongue, you chew here, then you go to your pharynx, it go to the esophagus, it go to the stomach. A lot of enzyme is used here. In the tongue, in the mouth, we're using saliva enzyme, amylase, they call it. In the stomach, we have enzymes, we have renin, peptin, acid hydrochloride, all these things, some kind of enzyme. We can increase some additional enzyme. And liver also need a lot of enzyme. Your gallbladder also need an enzyme. Your large intestine need an enzyme. Your small intestine need an enzyme. Your pancreas need an enzyme. When you want to throw out your food, you need an enzyme to make sure the overall system working fine to throw out the junk from your body. So enzyme is used end to end of the system, from the food enter your mouth out and it out from your body. Okay, this is why enzyme is very important to make sure all the functional organs working friendly. Okay, working very friendly to you. If you're not friendly with you, you have a disaster. Okay, so what is cordypine? Cordypine is fermented pineapple with the cordyceps. Okay, specially blended. Okay, specially blended. Okay, so it used as a traditional medicine so many years. Okay, it increase the respiration system, so you can improve your oxygen system. It also improve your overall system and make your quality of life. Okay, so now we can get cordyceps sinensis when we can culture it from the lab actually. Last time cordyceps sinensis is not easy to get. It's a very hard to get, it's type of mushroom that very hard to get. But now with the scientific, we can do a cultivation technique. Using the cultivation technique, we can do a mass production. Okay, and why pineapple? Pineapple consists of bromelain, the enzyme called bromelain. This bromelain is they call it enzyme proteolytic. Okay, it highly used for the digestion system. Okay, enzyme protein is an enzyme digestion protein. Okay, it used for process the protein in our body. When our protein in our stomach has been digested properly, the main product, protein at least highly utilized by our body. But when you want to use highly balance the protein in our body, when you have a proper enzymes to break down the protein, then we have a lot of energy levels balancing in our body. It's very important. Bromelain is used for it. That's why only fruit that you can eat after food is only pineapple. Immediately after food is only pineapple, because pineapple enzyme contain of bromelain that will help the digestion. Okay, so we must know what a kind of enzyme that very important to our digestion, because a lot of people are suffering from the digestion problem. That is the main cause of everything. Okay? Main cause for everything. Okay, pineapple can use as an enzymatic treatment, and when you use the pineapple with the proper fermentation process, that how DXN do, with combined with the cordyceps, it become very powerful enzyme to our body system. Okay, bromelain can combine with few type of enzyme, peroxidase, acid phosphate, protease, calcium. These are the type of the enzyme that can work combination with bromelain. Okay, bromelain can work together with all these kind of acids. Okay, that needed for the digestion of the food to convert into proper nutrient and proper balancing to the human body. Okay, so how bromelain help our body? It reduce the inflammation of our organs and tissues. Okay, it helps us to digest. It helps us to improve the accidental damages and surgical damages. Okay, that's why Cordypine we always given to the people who have any tissue damages, joint damages or accidental damages or digestion damages. So Cordypine is the one that can be used by anyone to balance the system. It's a very powerful enzyme in DXN, and it's also, I can say, it's like a patented ready. I don't see anything like that in anywhere. Okay, and even though I see it's not powerful as I see in Cordypine, because when I give Cordypine, I have reversed quite number of kidney damages people. When the creatine level is very high, by giving a Cordypine, we can see the kidney is improved. We can see the inflammation improve. We can see the bone tissue improve. We can see the inflammation is reduced. Okay, so a lot of testimonial we have actually. I've treated with so many. That's why one of the fastest product selling in my center is Cordypine, because I'm using Cordypine maximum to treat the patients. Okay, so what is the difference between, okay, when we eat normally when you eat a ripened, see, when you want to eat the pineapple, you must eat a fully ripe pineapple, then you can get the benefit of the enzymes. So you cannot eat half ripened fruits, cannot. You must make sure it's a fully ripened. So, but when you fully ripen, as I tell you, if you get 100% of the enzyme in a fully ripened fruit, if I fermented the fully ripened fruit, I can get 200% of the enzymes. More enzymes when you fermented it. That's why fermentation process is a very powerful process to make sure the enzyme is highly utilized in a human body. Okay, so from the main product, we weighted it and we formulation it. Then after that, we fermentation it. Then we fill up into the bottle. Okay, then we close the bottle, close it. Then we label it, we quality control, we pack it, and we send to the warehouse. So this is a process that's happening in DXN, and it's very free from any kind of pollutions. And it's halal certified. It's not applied any additive, coloring, or any preservation or any synthetic product inside. No, it's completely free and completely original. It has gone through and passed through the GMP and also got all the quality ISO 1400, ISO 9001, ISO for there's another one I've got it. Okay, there's a few things, few ISO, and also it also endorsed. Okay, TGA endorsed. Okay, so cordyceps is actually cultured as organic, and we have an organic certification for this cordyceps. Okay, it can easily absorb. Okay, easy to prepare, and it's halal, and it's been approved by Jakim. So it's very halal. It's halal. Okay, very clean and halal product, and used and suitable for everybody. Okay, so it used for all kind of people. Okay, how you can use, if you want to drink, like just for maintenance purposes, you just want to drink it, so you always can take 20 ml of Cordypine. You can mix with the 180 ml of warm water, and you can just drink it, and don't keep more than 4 hours. Okay, make sure you drink earlier. Okay, because when you keep long, the fermentation, the outside exposure can make other bacteria can affect it. So we have to drinking as fast as possible. Okay, and if you open it, you can put in a fridge, or you can put in a room temperature, no problem. Okay, so you can take it after food and before food, no issue. Sometimes people question, after taking Cordypine they get a gastric pain. Okay, it's not actually gastric pain. If you really see, Cordypine is actually alkaline, it's not acidic. Okay, it's alkaline, and it's very powerful enzyme. So if you feel before eat, you take the pineapple enzyme, you feel a bit like gassy, you take after food half an hour. So you can convert your time frame, it doesn't matter. Okay, so I go back to the page again, where to close stop share. Okay, so we have 34%. I think hopefully the Cordypine will help you, and it highly utilized for lung kind of treatment, kidney related treatment, and also a urination treatment, anything of the digestive treatment, digestive, respiration, this what do you call blood circulatory, urination for the what do you call nephritis, nephro treatment. So all these things we can use a enzyme to balance it. Even though diabetes, you can use it. Sometimes people will question me when I give when they drink for diabetes people, after they drink the Cordypine, they can see the sugar level is elevated. Actually, it's not elevated. It's actually cleansing that sugar that's saturated in your body. Because Cordypine is not nobody added sugar inside. It's a fermented. When you eat that, it helps the sugar that's saturated inside your kidney, inside your eye, inside your blood vessel, inside your other parts of your organs. Okay, it starts to go inside to the cell and remove the toxic from the cell out. So people like diabetes will see, hey, why my sugar level is it? Nothing to be worried. Nothing to be worried at all. You just keep on taking. You can see the lake become dark, lake become clean, become normal color back. It not happen in single night. In 3 months to 6 month time, you can see the black lake, the black color lake, it become a normal color back. A lot of people like gangrene. You can see a lot of gangrene people I give the Cordypine. After 3 months to 6 months, you can see the lake color is changed, become a normal lake. Okay, it cannot be done with any medical medications. No. Okay, in modern medication system, we have to remove the lake when it becomes gangrene. But using Cordypine, I've treated so many lake. I saved so many lake. Even the wound, varicose vein, it can penetrate. It can clean up all the pipe vessel, the blockages, especially sugar blockages, and also blood blockages. Cordypine has a power to cleanse it, and also it has a power to dilute the blood. It also a blood diluter. It helps to dilute the blood. Okay, there are so many functions has been used for the what do you call for Cordypine. Okay, so any questions on the Cordypine? If you have any question on the Cordypine, I give you 1-2 minutes. You can unmute the mic and you can ask the question. Before we go to the question and answer, anyone want to know anything about Cordypine?
Yes, doctor.
Yes, Rita.
Yeah. Yeah, when somebody takes the Cordypine, yeah, indeed you say they will experience gastric. So what causes that actually? If it is alkaline?
Okay. That the causing of the gastric is actually inside the stomach is already have a lot of acidity. So there's a balancing happen. You see, Cordypine is not acidic. Cordypine is actually alkaline. Okay, they call it semi-alkaline level. So when this alkaline enter the stomach, that already has the acid. Okay, it start to neutralize the acid in the stomach. When it start to neutralize, people will experience like stomach pain, all these things. They just go ahead, don't worry, keep on taking. Then when all the stomach regulated back, then everything will go back fine. So sometimes there's an ulcer in the colon. Bromelain and cordyceps has very powerful effect on ulcer. We can heal the ulcer wound. Okay. Sometimes when the wound is very active, when the cordypine enter the ulcer area, you will feel the pain. But if you keep on taking, the ulcer will improve and the ulcer wound will be completely dissolved. It takes time. So that's why sometimes people cannot wait. You immediately want to see the things, cannot. You have to take. So when you take 5, let's say you take 10 ml, you feel the pain. Next day, you reduce to 5 ml. You feel the pain. The next day, you reduce to 2.5 ml. Then you see the pain will reduce. Then you maintain 2.5 ml until few days. Then you increase back to 5 ml. Then you increase back to 10 ml. Then you can see the total differences. Okay. So any ulcer, I've treated ulcer when they come to see me, okay, with a lot of ulcer in the stomach. After they go through the treatment for 6 months, they go and scope again, they see the colon become very clean, no more ulcer. This is a shock to know. Actually, this is a shock because in the industry of modern medication, there's no healing for ulcer. They will maintain the ulcer for a long time. If the ulcer become very big, we only can do the surgery and connect it back. The ulcer area they will cut. Okay, so then we have to also, by taking this, we also have to maintain our food lah. Not like taking this Cordypine and antam all the chicken rice la, mutton la, every meat you attack, then become boss la. How to recover? So you have to give the stomach a rest when you have a treatment. Then slowly you will become recovered la. Okay, food also playing a big part. Okay, even though when you are getting treatment, that's why you see when you are admitted in the hospital, why they put you in the hospital? They ask you to admit because they are controlling your food. You cannot simply take. They give you a good food. They ask you to sleep. Because if you send home, you won't sleep. You will unthumb everything. You try to eat everything. Then how to recover? So they catch you, admit you for 1 week. Or your food is taking care. Your sleep is taking care. Some beautifulness is taking care. You feel happy lah. Okay. So these are the things. Okay. So that's why it's like that, Rita. So if they keep on taking, but they can reduce it. By taking 2 times, maybe you can reduce to 1 time, but they don't stop. Keep on take. In a longer run, in 3 months time to 6 months, you can see completely will reverse back. Okay.
Would it be better to combine it together with enzyme too? Because enzyme, more enzyme also has high.
You can add with anything. Cordypine, you can go single or you can add with Cordypine. You can add with more enzyme. You can eat with more enzyme. You can add with more roselle. You can add a GL powder. You can add a roselle powder. You can add a Hong tea. It doesn't matter. It can go along with anything.
Okay.
You can go along with anything. It can be converted into fruit punch. Okay, you can convert it to fruit punch. You can create your own fruit punch. It's very powerful enzymes. Okay.
Okay. Thank you, Doc.
Okay, thank you.
Yes.
So now we're going to the question. If you know question.
Doc, hang on, Doc. There is one more question on Cordypine. Annie is asking, Cordypine is to be taken best need or do we need to dilute it with water for best result?
Okay, because the solution is very thick. Okay, remember the solution, the fermentation process is very thick. When the process is very thick, sometimes you cannot drink it like that. You will feel like a pure wine. Sometimes you see people want to drink something like very thick and they feel unusual. But it doesn't matter. If you can take it, you can take it. No harm. But you will feel your throat become very tough lah, heaty lah, because it's a highly fermented. Okay, it's highly fermented. The process of fermentation is very long, almost 1 to 2 years, 3 years like that. So then it becomes very thick. The more you keep the cordypine, the more powerful it is. It's like honey. Fermentation things is like it's very powerful when you get older and older. Like a wine lah. 10 years wine and 20 years wine. 20 years wine is more 20 times pricey than the 10 years wine lah. It's like that. So that is how. You see, the cordypine, the fermentation process is already like a wine, you know. You must remember, if I add alcohol, it's already wine ready. Okay? So it's a process. Fermentation process is almost like a wine. But you add alcohol, it become a alcoholic lah. If you don't add, it become a fermentation process. Same thing. The what you call what is that? The wine oil, the grapes. The process is the same. You ferment it. Then you take it, you put alcohol, it become wine lah. If you don't put it, it's still a grape juice. Huh? Correct or not? Huh? If you put alcohol, it become wine. If you don't put the wine, it become grape juice. This is the two difference. Okay, so that's why fermentation process is very powerful. Why?
Yes, doc, correct.
You can increase your enzyme. That additional enzyme you give to the body for the metabolism. It's a very powerful food. That's why in those days, in the old ancient times, you can see all these things has been created. And fermentation process is not 1 2 days, not the now technological time. It's been used widely in China, Japan, every country. Okay, in every country, Greece, every country, you go Australia, every country already practiced so many years ago. It's not new things that people are doing now. No, it's old people. They need to like to eat all these fermented processed food. They keep the process. They make the fruit to keep longer. Then they use the fermentation process because it's highly enzymes. Okay. So if I'm not other, I can go on with that questions. Any ready?
Yeah.
Okay. Okay. So the first questions. Merasa kebas seluruh badan, tak selesa tidur malam. Okay. Then you have masalah buasir, kawan ni sudah lama menderita kesakitan. Okay. Merasa kebas seluruh badan, tak selesa tidur malam. Very simple. When your body has the numbness, definitely is the cause of the circulatory issue. Circulatory issue, blood, darah tak mengalir. Bila darah tak mengalir, tempat-tempat yang tak mengalir automatically become kebas, become numb. Okay, numb. That means no blood flow. If your hand, you lock in this is the blood flow area. You lock the blood flow area for a while, then you can see your hand become numb. Why? I block the blood supply towards the hand. So when these kind of people, when they have this kind of thing, the first thing, they don't have exercise. Okay, they never go out for walk. They must go out walk. You must remember, if you want your car to be healthy, you buy a new car. You want the car to be run fine, you must drive it. Okay, if you don't drive it, you keep in your garage for 1 year. Just clean, vacuum, clean every day, but don't drive. What will happen to the car? Spoil. The circulation of the petrol, circulation of the oil, everything need to be run when the car is drive. The tire, everything has to run. Same thing to the human body. You need to make it run, to make it work. If not make it work, the blood flow cannot enter all over the supplies. Cannot. The blood vessels. We have almost 400,000 kilometers of blood vessels. In the medical world, they always say 100,000 kilometers of blood. That's the main only. If you break down into the small vein, head itself for 1 million blood vessels already. Too long, too much. Okay, it's like every house got road, every cell got blood vessels, because the supply of the food towards the vessels to the cell. So every cell must get oxygen, must get nutrition. So when the blood vessel is not filled, okay, you will have numbness. That's why by exercise minimum 30 minutes will give you circulatory issues. Okay, the second thing maybe is blood is hemoglobin level or RBC level are low. People are low blood that not produce thick blood. Blood is thick. Also will have this kind of problem because the circulation is not good. There's not enough oxygen to the brain area. That's why they have not enough sleep. Okay, and masala buaser always link back to the circulatory system. Okay, buaser link back to the circulatory system. If your circulatory system not good, your toilet automatically have problem. Okay, toilet problem. So what you can take, what you can do. Okay, what you can do. First thing, apart from the medication, what they need to do, sleep early. Number two, at least 30 minutes to 1 hour daily walking enough. Walking, clapping, tapping, swinging, flying. As I always teach you, clapping, tapping, flying, okay, and swinging the hand. Walk 30 minutes, do all this for. Okay, then the blood flow will be start to run all over small blood vessels. Okay, it's like very simple things. When you have like you see when the water level in a river when go too down, you cannot send the water towards a small agriculture area. So normally agriculture area surrounding the river will have a small part, a water part. Okay, but when this water part, the river level of the water come down, the water part will dry. Okay, the water part will dry. So when the water part is dry, there's no supply. You cannot make your agriculture fine. All your agriculture will dry. Okay, so you must increase the water level. When the water level increase, it start to penetrate. Let's say you think, first time when I increase the water level, first time after few months, the part getting the water in, the water will flow or water will trap. The water will trap first, absorbed first. Once absorbed, then it will be penetrate. That's why a lot of people, when we have the circulatory problem, when we give RGGL, all this our holistic medication to them, they will feel headache, they will feel fever, they will pain, they will, because lot of blood vessels that dry, not filled, has been filled with the blood flow, make the whole body tired, weak first. Later part, when all the cells are supplied with the nutrition and oxygen, you will become healthier and healthier. Okay, this is a process of peak and go back to normal. Okay, that's how it works. Okay, and masala buaser is also a circulatory issue. What you can take, you can give them a mycoveggie, morinzyme. Okay, mycoveggie, morinzyme you can give. Okay, for cannot sleep well in the night, you can give androgy. Androgy will help them to get a good sleep, because androgy is also a blood thinner. Okay, it also a blood balancer. Okay, an antibiotic and also a painkiller. It will act so many things. Okay, so when you give that, you will feel better in the nighttime sleep. For the buaser, give them mycoveggie morinzyme. Apply the gano oil to the area of the buaser area. Okay, if that buaser is, there are two types. One is outer layer, one is inner layer. If outer is okay, apply at the outer area. If inner, you just take 3 ml of your gano oil, take the syringe, apply into the anus, just pump into it while you before you sleep. Okay, so the oil will penetrate towards the area, that inner wound area. That you can do that. Okay. Question number 2. Macam mana, apa ni banyaknya, panjang betul. Macam mana ni ada kawan saya selalu mengadu dengan bagaimana mengubat dalam burit selalu gatal, kuka. Okey, sampai berdarah dia garu, okey, Gano oil, toothpaste, dia pakai Colgate, bilang dia punya gatal, okey. This is due to small bacteria issue. Okey, dia ada ulat. Masalah ini actually there's a small ulat. Okay, ulat is moving towards the colon area. So you must clean that. You just clean outside for what? You must clean the overall colon system. So what you can give them? Give them the myco-AG morinzyme, Andro-G black cumin, and virgin coconut oil. When you take that, the overall piping system has been cleaned out. Like your pipe sumbat lah. Okay, you letak chemical kan, so pipe sumbat okay already what? Okay, so when you sumbat, then you can see air keluar sikit. So it's like that. So when the colon is not clean, very dirty, there are small ulat lived in the colon area. So this will start to move towards the area and start to make the itchiness. So when they put the Gano oil and toothpaste, it heals for temporary, but still the colon is not been clean. Okay, you just clean the room, you don't clean the house. So tomorrow, because the room is not clean, the house is dirty, the hall is dirty, the dirty will come in back to the whole room again. So you need to clean the house, not the room. Okay, so you get the medication, you go and take, then everything go back to normal. Okey, ada lagi satu minta tolong macam mana mau buang bau ketiak ni. Dia mau berjalan dengan kawan dia, mandi pun tak ada hilang. Bau ketiak ni, you must remember, ketiak is the place that one of the energy level balancing area, heat releasing area. That's why when you heat, the gas of the heat released through the water from the ketiak area, the area, armpit area. Okay, that's why always when you have heat, it will wet. Why? It's a releasing of gas. Okay, so why? The circulatory system, the blood is very intoxicated. Darah kotor. This kind of people always eat a lot of meat and lot of fast food. People who eat fast food lot, meat lot, lack of vegetables, lack of sweating, they have a bad water internally lot. You must remember, every day we must sweat. I take one bottle of water bottle, okay? I open it, I drink little bit, you keep it inside your car. After 3-4 days, you just take the water and smell. Smelly is it? Very smelly. Why? Because the water is already exposed. Same thing in your body. You are drinking water, you're just waiting for the urine to go out. But there are a lot of water inside your body trapped. Trapped water is actually intoxicated. That's why sweating exercise is very good. The moment you're sweating, you drink clean water. You are exchanging the water now. Okay? People never exchange the water in a body every day. In the long run, the water inside their body is highly intoxicated. That's why I always say, go half an hour. Spend your time half an hour outside. Do some activity to sweat it out. Throw the bad one, take the clean one. Okay? Throw the bad one, take the clean one. So you drink clean water, you must remove. You don't depend on urination system. Urination system is one part of your toxic output. Second output, your toiletry system. Third output is your skin. Your skin playing a larger role in your body to remove the water, extended water inside your body to cleanse it out. That's why after you sweat, you take the shirt, you don't wash, you just hang into behind your door. After 2 days, just smell it lah. Okay, smell good. same as your armpit smell. Okay, so change, then hygiene, then this will help you to clean it. Okay, there's also another process you can do. You can take little bit of vinaigrette. You can use honey vinaigrette or vinaigrette. You can use vinaigrette. You can add in little bit of pearl powder, vinaigrette, little bit of pearl powder, and little bit of virgin coconut oil. You make it a small spray bottle. You keep it. You just shake it. You can spray it little bit when you go out. It will can reduce the smell. Okay, or you can use our talcum powder, Dexan talcum powder. Okay, Dexan talcum powder, you can use that. Okay, so when you use that, you can feel much better. The smell will reduce. Okay, can use all our body form, all these things for your helping to Yola. But you must clean it your system. What can help you to clean your system? You can take RGGL or Richelium. Okay, RGGL or Richelium. Take Morinzi lot and Cordypine. Morinzi, Cordypine, Richelium. You mix all these things you drink every day. Then you can see slowly all the toxin will come out from your body. Then you will have smell good. But you must remove your dirt things also. You must everyday exercise, throw out all your sweat out. Okay. So number 4, gigi yang kuat kuning ni, dia minta pendapat saya macam mana buang yang dicela gigi ni. Saya pun tak. Okay. If your teeth got plaque, okay, you have to go and see the dentist. Ask them to clean it for you. That's why 1 year minimum, at least 1 year once, you must go and clean the plaque that stick inside your teeth. That's why every time when you eat, after that you gargle, throw away, because the food that stick inside the teeth area, it will become a plaque later on. That's why I always keep a stick, cleaning the stick. After you eat, if something stuck, you just remove it from your teeth. So you have to make sure your teeth is always hygiene and clean. Then you don't have a gum problem or losing the teeth problem. Okay, no bleeding, no nothing. You can use our toothpaste. Okay, but if you want to remove all these things, go and see the dentist. After removing all the plaque, they will wash your teeth, everything cleanly. After that, use our Ganotherapy toothpaste. Morning, night time using the Z-Care. You see, a lot of people asking me, why got so many toothpaste in DXN? Okay, you can have 3 type of toothpaste. You must remember, they got a Ganotherapy, they got Ganotherapy Plus, they got Z-Care. The actual utilization is like this. Ganotherapy is a normal one. Okay, you can use morning, night, no problem. The Ganotherapy Plus, no added any sugar inside. It's a very rough. Okay, very rough. Okay, and more mint. So there's a 2 type. So sometimes children don't like the taste without sugar, because the moment they put into mouth, they feel very, very tough. So that's why Ganotherapy Plus, lot of adults like the plus. They don't want sugar, they want the plus. But people also like with sugar, they want a taste. So that's why the Ganotherapy toothpaste. But the Z-Care actually used for night. In really, you use it for night cleansing, night brushing. When you sleep time, you don't need any mint or whatever. You just use the Z-Care, the green color one, the small one, to brush and clean, to enhance the strengthen of your gums and the teeth. That's why Z-Care, I always advise them, use at night. Ganotherapy, either plus or normal, use morning. So you keep on using the Z-Care at the night, you can see your gums bleeding and your gums become more strong, and very hard you're going to lose your teeth. Because when your gums strong, your teeth become strong. Because they're specially formulated, lot of ingredient and nutrient for night time, because night time we're going to sleep. Daytime, morning, after that we start to eat. But night time we wash, after that we don't eat. So we make sure a lot of enzymes and nutrient filled to long hours when we wake up in the morning. So we almost have 8 hours to make absorption clear, and your teeth become more clear and more stronger. Okay, that's why ZK4. Okay. So the next one, selalu kebas belakang badan, bau tak berapa lena, tidur hampir 2 bulan, tak mengalami monascus, spirina, GL, sometimes intake androgen like comment. So what to say that? They also tell the thing, they also tell not to eat. Okay. So that's why I always say, kebas, numbness is always about the blood circulatory system. You need to do a exercise to blood circulate your system. The moment you do a blood circulation, you see, and that's why I always say, when you go running in the evening, do some exercise, that day, night, you can sleep well. Why? Because you already circulate your blood. All the 60 trillion cells in your body already get oxygen and nutrient. It has time to relax. Okay, that's why exercise is important in this part. When you keep on do exercise and eat on time, then you don't have the pain, all this kind of thing. Okay, kebas belakang badan, because circulatory is a bit weaker in the body base. So you already put your monascus, spirina, GL intake. I suggest you better you take a Cordypine also. Just add in the Cordypine and see. Because Cordypine is a neuro system. If your any nerve is damaged or injured, it can help you to repair back the injury nerve. Sometimes numbness also can happen due to injury. Maybe they fall down, long time injury. There's maybe a blood clot there, so the blood cannot flow that area. So you take Cordypine, it can help you to flow. Okay, to have flow. Okay. So number 6, batuk yang ringan tapi berpanjangan berbulan-bulan. Okay, batuk ini is very if people see, if the cough is not stopped, we have to see in few angles. The first angle we have to see whether any bacteria affecting your throat. So if bacteria affecting your throat, you always feel the itchiness in your throat area. Okay, very simple. You just take the Andro-G, every 4 hours suck 1 capsule. Andro-G. Then completely all the bacteria in the lungs area, throat area will disappear, and immediately the cough will stop. Okay. Second thing, if your lungs contain a lot of phlegm, also you will have a cough. So the best thing what you can take, Lignus's syrup, the cough medicine, Lignus syrup 10 ml. Take GL powder 1 scoop. Okay, mix with a Cordypine or the Lignopine, mix it and drink. Repeat every 3 hours once. Then you can see it will stop. Okay. The third thing, if it's never clear, you have to go and check your lungs area, whether there's a water retrenchment or any tumor or whatever in that lungs area. If nothing, if got also no problem, keep on taking the solution that I give, then slowly it will be recovered back. Lignus syrup, GL powder 1 scoop, 10 ml Lignus syrup, Lignus GL powder 1 scoop, Cordypine or Lignopine 10 ml, mix in a 20 ml water mixture. You just take small amount of water only, 20 ml warm water, 10 ml Lignopine or Cordypine, 10 ml Lignus syrup, 1 scoop of GL powder, shake it, drink. Repeat every 4 hours until completely the cough stop. Okay, then once it stops, instead of 4 hours, make it like 5 hours once. When you keep on reducing, you just increase your time frame. Then 6 hours one, then 8 hours one, then 1 day once, then 1 week once, like that. Then slowly you stop it. Okay, next. Sakit otot selalu mengantuk. Sakit otot selalu mengantuk. Sakit, all the joint pain is about the uric acid. The effective medication for uric acid and selalu mengantuk, because the circulation is reduced, lack of oxygen, lack of exercise, lack of sleep, this will also always you feel want to sleep. Okay, so you can take Cordypine mixture with Richelieu powder. You can take black cumin and androgy. Okay, Richelieu powder mixed with Cordypine is very powerful for uric acid removal. And take a lot of spirulina. Then it will convert the uric acid become alkaline back. Okay. Mengekalkan kekuatan tenaga. Okay, kekuatan tenaga is very simple. You need enzymes, you need oxygen, you need enzyme, you need oxygen, you need some vitamins and minerals. So very simple. If you want to maintain your health, energy, you can take fruit zim, mix with the GL powder, you can mix with the Cordypine and take spirulina more. Then you can see your energy level balanced. Okay. Or you can take morinzyme mixed with the GL powder. It also can give you energy, immediate energy to you. Okay, mix in 1 glass of warm water or half liter of warm water. Then mix with all these things, drink little bit. Then also will help you to energy balancing. Mengekalkan kekuatan tenaga batin. Okay, Cordypine is very good. Mengekalkan tenaga batin, all these things is actually circulatory issue. It comes under the circulatory issue. That means blood circulatory issue. Okay, so to improve your blood circulation, you can take RGGL, Cordypine, and now we have potency for guys. Ladies, you can take Morinzy. Okay, Morinzy will help you a lot on these things, and also spirulina to increase lot of vitamins and minerals to your body. Okay. Kadang-kadang kaki kebas masa tidur. Okay, masa tidur kaki kebas, sometimes very cold. Sometimes you bend your leg. Sometimes you bend your leg accidentally, like you sleep, you overbend your leg. So the blood flow is reduced and it become cramp. And it also come under the circulatory issue. So you can take Gano oil and apply it to the underneath your legs, your foot area, just massage the foot area before you sleep. And your leg area with Gano oil, and you can take this Cordypine. You can take morinzyme mix, okay, to enhance your blood circulation in the night time. And also you can take the androgy. This will reduce your the numbness on your leg area. Okay. Masalah mata dalam telinga gatal, sudah masukkan Gano oil tapi datang lagi gatal. Okay. Mata dan telinga gatal. Okay, this is actually allergy. Okay, they must have a allergy. When you have a lot of allergy, the best allergy medicine is black cumin and roselle. Okay, try to take the black cumin, androgy for maybe antibiotic, because maybe some infections or maybe some allergy issues. Okay, and you take androgy, black cumin, apply the Gano oil and take roselle lot. Maybe roselle you can take 5 tablets per day every day to balance your allerginess. Roselle can very effective as an antihistamine tablet. If you have itchiness lot, if you are allergic, you take more roselle. It doesn't matter, you take 5 tablets, 10 tablets. Okay, you can take as much as possible until your allergy go back to normal. Okay, when anybody have allergic, things like suddenly they eat something, become swollen, all these things, give them a roselle maximum. It works as an antihistamine tablets. It's very natural and very safe. Okay. Okay, this one I already answered it. Just not take directly or dilute water. Both you can do. Masala bisul. Masala bisul actually comes from high toxication body. The toxin in our body is not been removed from the thing. See, our body, first thing, try to remove when you take the toxin, when the toxin start to enter your body, first the body start to use the secretion system. That means your toilet, your urine, your sweating, the main, then your maybe your flame, that's a fourth, your saliva, fifth, okay, your eye, the toxin from the eye, toxin from the ear. This is all the 7 small layers. This is the first level of defense system. When the first level of this defense system is start to fail, body cannot remove the toxin from the body. the second level defense system will take. It will start to come out with small boils in our body to release the toxin out from the skin. That's why psoriasis, eczema, all these things is under the second level defense system. When it comes to holistic medicine, we can reverse that. Nobly. I've treated so many patients. Instead, I'm also on an eczema, highly worst eczema patient, 20 years back. Now completely free. Okay. I don't take any medication. Using holistic medicine, I reverse back. None of the specialist centers I went last time, nobody can help me. Spend money so much, nobody is no useful at all. But after I take learning the study, nature medicine, holistic medicine, I reverse back. And after that, I've reversed so many people's skin problem. Okay. Last time there's one specialist doctor in Kajang. He have a skin clinic there in Kajang. All his patients he bring to me. If it psoriasis, eczema, he will bring to me. Okay. Other than that, he will treat because there's a level. So this B-Sol is some second level defense. It start to penetrate it out. So the people always have like B-Sol hand, B-Sol here. After a while, it become reddish and become got pus inside. Then they break it by itself. You go hospital, they will cut. Don't ever cut. You can apply the Gano oil mixed with the Androgy or RG. Gano oil mix RG, mix Androgy. You can mix little bit of turmeric. Mix it like a paste. Apply it on the overall of the tumor. Keep on apply. When you keep on apply, and internally you give RGGL, Androgy to eat. You can give mycoVG and morinzine because you need to clean the colon also. MycoVG, morinzine for the colon, RGGL, black cumin for the system. So when this one keep on taking, you can see the B-Sol become thick and become swollen and it break. Once it break, you will all remove all the pus out and put a RG powder on the nip of the where the pus is out. Then you can see the B-Sol will disappear. So when you keep on taking all this mycoVG, morinzine and RGGL with black cumin, you can see new B-Sol also can come out. This B-Sol is not new. It's already there. That already cannot stay inside. It will come out first. So you will go through a phase of cleansing. This is a second level of fencing. The third level, when you cannot remove it from the skin, it will go put as a put aside. The put aside is a tumor and cancer, become cancer. Put aside cannot come out unless you do surgical. Okay, surgical. So put aside is the third phase of defense system that the body failed to remove the first level, second level. So third level is a tumor. Always we call it as a cancer. Okay, this is how body playing the game in our body. Okay. Next. Ingin mempunyai anak 4 tahun berkahwin. Okay. Okay, this case is very subjective. We have to see whether the wife or the guys have problem. So based on that, if the wife have problem, then we balance the wife. If the guy have problem, we balance the guy, then we connect it. So there are a lot of things need to see in this picture. It's very subjective. If possible, you can contact me separately. I need to know what is the problem, all these things. Then I will give you a good prescriptions. Okay, it's very subjective. But basically, if you want to take, I can give you a basic one. For the lady, take bee pollen, morinzi, richelieu, lion's mane, and virgin coconut oil. For the guy, you can take potency, richelieu with morinzi, bee pollen, and virgin coconut oil. Okay, so you can try this solution first for 3 months. Then if you cannot get pregnant anything, just call me. Maybe I need to see the system, which part is the problem, or you can see our subject expert iridologist, then they can advise you better. Okay, so number 13, masalah di dalam telinga air dan warna hijau keluar dari telinga. This is infections. Give them the RGGL basic and put Gano oil every day, 1 drop to 2 drops every day. Then these things is solved. I give given to so many people, okay, unless the drum not whole. If drum is whole, then you have to go to the hospital, do a patching, okay, surgery, small minor surgery to do the patching. If no means, then you can just use the Gano oil, RGGL, you give them, then these things will okay. Vitamin C must give, Roselle must give lot, okay. Next, number 14, Androgy. Why must it be taken 20 minutes after the product? What happened is take together. Okay, it doesn't happen anything. So always I told them Androgy take after means we give some gap because Androgy is very bitter. Sometimes it can give some complication with other. It can reduce the functionality of the main product. So when you give separately, it can help the main product. Say you eat RGGL, go first. After half an hour to 1 hour, then you take Androgy. When you take together, Androgy is very powerful. Androgy also can suppress the originality of the product that you already eat previously. Okay, that's why I always say take the Androgy separate. It's much better. Okay, you want to take together also you can try, but your current product, the properties will reduce. Okay, so I don't want it to reduce, so take it separately. Give a half an hour to 45 minutes gap, then you can take the Androgy. What's the difference between Morinzi and Morinzan? Each taken for the problem. Okay, it's very simple. Morinzi is an unripe fruit. Morinzan is a ripe fruit. Ripe fruit has more enzyme. Unripe fruit has more iron and other minerals things. So for ladies problem, menstrual issue, blood cleaning, blood toxication, okay, you want to balance your blood, repair your liver, Morinzi is very powerful. Okay, your blood is clotting, Morinzi, you drink Morinzi 1 bottle 1 day also no problem. Okay, Morinzan is the same fruit that already fully ripened and fermented. Okay, ripened and fermented. This ripened and fermented fruit, Morinzan, will give you more enzyme, probiotic and prebiotic to your colon system. So whoever have any problem regarding colon issue, colon pain, ulcer, stomach issue, gastric, anything about colon issue, you can give them a Morinzan. The prebiotic will create a more hungerness and balancing to the good bacteria, and probiotic will improve the digestion system. People who keep on vomiting out, always vomit. You mix the Morinzan and give them drink every half an hour, the vomiting will stop. People with food poisoning, it lot of bad bacteria inside the stomach already. You give the Morinzan, the prebiotic and probiotic will kill the bad bacteria and make your diarrhea stop. Okay, so it can be used for every purpose of the colon system. Anything wrong with your vomiting, diarrhea, all these things, you use Morinzan. Anything wrong, you want to clean your blood, you have menstrual problem, blood toxication, liver problem, all these things, you go back to the Morinzi. But if you want to mix and give, it's no harm. Actually, both has the functionality, only some has high a bit, some has low a bit. So it doesn't matter you give Morinzi or Morinzan. In reality, both can work well, but for digestion system, enzyme is a must. Okay. But can you give this one to the cleansing the blood? Also can. It also can work as a Morinzi. Okay. Clear? Good. So Morinzi, period, problem, you give Morinzi. Period never come, you give Morinzi. Period come, never stop, you give Morinzan. You understand? For ladies. Never come period, you give Morinzi every day. Period come, you stop. Then period come, never stop, 10 days, 15 days, you give Morinzan to drink. Then period will stop. Okay, because both is hormone balancer. Okay, both is hormone balancer. Okay, next. What product to take peptic ulcer and diverticulitis? Okay, for both this is actually colon colon problem. Diverticulitis is the colon is diverticular, become very smaller and smaller. They mean lack of fiber. Ulcer, you don't eat on time. Why ulcer happen? Because the acid hydrochloric that form in the stomach is coming down towards your small intestine, make your small intestine alkaline become acidic. This will create lot of ulcer in the colon area because acid should not be in the alkali room. Okay, acid supposed to be in the stomach, not used in the alkaline room, small intestine. So when it go into your large intestine also acidic, and you tamba acid anymore, it also can cause a wound and ulcer in a large intestine because too much of powerful acidity. Acid hydrochloric is pH 2. It can damage the colon system. That's why the time of food is very important. 7 to 9 is your breakfast. 12:30 to 1:30 is your lunch. 4 to 5 is your tea time. 6:30 to 8:30 is your dinner. Don't eat anything after 8:30. Remember, don't eat anything after 8:30. If you want to eat anything, just drink a coffee or cup of coffee or Milo or milk or cocoa, anything enough. Maybe a single piece of bread or biscuit enough. Don't put solid food after 8:30 to make sure your colon don't damage. Then automatically you will have an intermediate diet from 8:30 towards the next day morning 7 o'clock. So almost 10 to 11 hours you every day will have the intermediate diet. The intermediate diet is automatically naturally happened from the day you born. Okay, it's naturally happened. Now people are talking intermediate diet daytime. Don't do that all. Don't damage your system. Eat on time. Balance your thing. Acid will form. You cannot tell the acid, it don't come. Remember that. Acid is the system control. You cannot ask the third. You cannot tell the colon, hey, I don't want to eat. Don't come the acid. Cannot. Remember that. System control you. Not you control the system. Remember, people always think, hey, why I cannot sleep? I want to sleep. Sleep is not yours. Why are you asking for? Your job is just close down your eye and sleep. The rest. Your job is only rest. The body will give you sleep. So sleep you cannot ask for. You must get the rest first. Then the sleep come to you. Same thing. The hunger won't come by the time you just eat enough. Okay? And you cannot ask the colon, don't give me acid hydrochloric. You cannot say. It will come. So when you're daytime, you keep on moving. You need energy. You're still using the petrol. The moment the petrol you keep on reducing, the enzyme will come, food will come. I just said petrol will fill, and you still keeping on. Night, you're going to sleep. Why you want to fill the full tank? You don't use your body what? You only lose a little bit of energy. So 8:30 food that you eat is enough for you to cover until the next day morning. Don't put too much and keep inside your stomach. A lot of people eating too much and may end up their stomach become problem. That's why a lot of diseases attacking you. You must balance your body. Okay, so what product to take for peptic ulcer diverticulitis? Very simple. Virgin coconut oil, mycoenzyme morenzyme. You can add in lion's mane. Enough. That's the basic. You give that every day you eat, then it should be okay already. Okay. So next, how long can I walk in weight bearing after distal tibia and lateral malleus fracture? Okay, how long you can? You can walk around 10 to 15 minutes, depend on your pain. You must understand your pain management. Don't force. Don't make it swollen. Okay, it will happen gradually. So you must follow accordingly. So the pain tell you, oh, I cannot take it anymore. Please reduce your walk. This is your communication between the pain and your body. So when you walk, you don't have pain. You can walk more. Let's say you try 10 minutes, you walk. You have the pain. You see the pain is increased. You stop, you relax. You walk. Next day you walk maybe 10, 15 minutes. The pain is increased after 15 minutes. Then that is your time frame. Then the third day, walk slowly. Don't give a pressure. Walking basically is not a pressure. Taking things, walking, climbing upstairs, going downstairs is a pressure for the leg. Just walk in a relaxed mode. Okay, this will give you more functionality. The blood flow will be improved that area. Then your healing will be more higher. Okay. Can I drive in manual after removal brace and cast? Sure, you can drive anything. Okay, it depends on your pain management. That's why I said your pain will tell you whether it's healed or not healed. You cannot cheat your pain, you know. Remember that? Okay, that is your symptom that show you I cannot take it. Please slow down. All of that. So when you put a brace, when you drive, for time being, put a brace. The brace, then you walk, you see how long you can do your walking, slow and steady. Then based on that, slowly improve your walking strategies. What else? Hey, okay. Vertigo or room spinning awake after sleep. How to reverse? Normally during early morning, only when lying down or locked down, look down. Okay, this is actually blood flow towards the brain. Okay, second thing, there's a pressure on the C6, C5, C6. So do a massage in the shoulder, left shoulder and right shoulder and behind the neck. Do take the gun oil, massage it for 1 minute left, right, 1 minute at the left, 1 minute at the right, and the behind the neck, just massage it. Then night, when you sleep, you can take Cordypine, gel powder, vinaigrette. These three things will help you to circulate the blood. Once your blood flow to your brain is improved, then the vertigo will disappear. Vertigo is a short time problem. Then second thing, vertigo also come to the people who never sleep properly. Always sleep 2 hours, 3 hours every day. You will get vertigo one day. If you every day you sleep 6 hours to 8 hours every day, then you see your vertigo will disappear. Vertigo is a blood flow. You must have a good sleep and the brain must have a good rest. Number 19, how to stop skin allergy, neck area very itchy. You can apply skin allergy, you can apply our Gano oil, you can apply our, after you shower, you can apply our lotion, aloe vera lotion. Okay, you can take a lot of vitamin C, Roselle tablets, black cumin, Androgy and GL. This will help you to reduce the allergy in that area. Okay, and you can see what is the things that affected you. Is there any small kind of infections, anything happened in your neck area? See that. Then if you want to wash it properly, you can use our body foam, apply, scrub it. Then take some turmeric also, you can apply, scrub together. You can mix our body foam, mix with the turmeric, mix it, apply on that neck area, leave it for 20 minutes. Then you take the scrub, you scrub it before you shower. Then you apply with the Gano oil. You can apply with lotion, anything lah. Try. Okay. The next one, how to stop smoking. Okay, smoking is very subjective. Okay, the one who want to stop smoking, they must ensure they want to stop. Okay, if I give them anything, then the friend is offer, he still go back to smoking. Okay, so no point. He must put into his brain that I want to quit smoking. If until he didn't put anything in his brain, whatever you give also, because the moment the friend offer them, they automatically will smoking again. So it's come back to the person itself. Okay, you can give RGGL, spirulina, black coffee, everything. This will help to cleanse the nicotine and the smoking ability in the body. But the mind, if he still want to smoke, he will smoke. You can't help him much. The first thing he need to agree that himself, no need to put a toxic inside his body. He must remember, if I give poison, he won't take. But if I change the poison into a smoking potion, what's the difference in taking the poison and taking the smoke? It's the same. The poison, slow poison and a fast poison, that's the two difference. Slow poison, smoking. Fast poison, all the smoke, the poison that inside the smoke, I take it out and put into one bundle. I give him to eat. That is fast poison. Okay, so in his mind, he need to know both is actually poison, either fast dying or slow dying. He need to decide lah. Okay, the person need to decide whether you want to die fast or want to live slow die. Slow die. Okay. Okay, the next question. Tiap bulan sakit perut. What's wrong? Bukan menstrual pain. Tiap bulan sakit perut, in something makan tak betul lah. Okay, first thing I always tell you, eat on time. 7 to 9 is your breakfast, 12:30 to 1:30 is your lunch, 4 to 5 your tea time, 6:30 to 8:30 your dinner. Finished. After 8:30, no food. If you want to drink, you can drink a cocoa or you can Milo, a small glass, half glass with one biscuit or one thing before. They call it supper. Only that is allowed. Maintain that first. Second thing, anything you eat, munch properly and eat. After eat, half an hour to 1 hour, don't drink water. When you drink water, make it sip by sip, don't glass by glass. Don't ever flood your system. It will damage your system. Okay? Use your saliva as much as possible when you eat. When you do this, then the pain will be reduced slowly. Okay? So if you feel that every month is thing, you must see what are the food that last you take when you have the pain. Then you try to stop that food and you monitor. Okay, you can take micro-AG morinzyme, you can take lion's mane, you can take GL powder, you can take RGGL, you even can take morinzy with Cordypine, you can take, there are a lot of, you can take our coffee, Lindsay coffee, you try. All our product is alkali, so you can take anything, okay, and update. DXN yang sesuai untuk orang dewasa asma, okay. You see, holistic medicine never treat any diseases. You must remember that. Ganotherapy treatment and holistic treatment, we are treating the system, not the disease. So it doesn't matter your asthma, your disease, diabetes, your whatever it is. Once your system is start to balance, everything will go back to normal. Okay. So it's for asthma, you can take lignopine, GL powder, spirulina, roselle, Cordypine, you can take. This will help you to balance it. Okay. Next, legs and finger pointers itchy. Okay, this is actually blood flow. Okay, or some allergic. You have to see what kind of allergic you have. Legs and fingers pointers are itchy means that the finger pointers are itchy means there's some allergic. Maybe you're allergic to some soap or whatever lah. You need to check lah. You need to check. You can increase your vitamin C, roselle, androgy, and black cumin, and see how is it works. Ramai yang mau buang perut boroi mau slim. How to improve fat metabolism? Very simple. You eat on time. Don't eat too much. Don't drink too much. Okay. So eat on time. Follow the time frame I told you. Eat, don't eat too much, don't drink, eat until your stomach is too full, it's wrong. After eat, don't drink immediately water, give half an hour to 45 minutes and do some exercise. Then automatically you can get a good, you can improve your throat actually. And to borrow the throat, you can do some exercise. For in our product, Monascus is playing a big role on this. Monascus, you take 2 capsules 2 times, then you take micro-AG, morinzy, okay, not morinzyme, morinzy plus vinaigrette. Micro-AG, mix morinzy, mix vinaigrette, then take 3 times daily. Then you can see a lot of differences. Okay. Number 22. After consuming morinzyme, richly roselle at night, the person always go to toilet very frequently. 5 times to 8 times occasionally, every reason is okay. So very simple. Roselle is water removal. Don't take at night. Take it daytime only. Okay, remember that. Roselle is water removal. Okay, when you take at night, you will remove water lah. Okay, so that's why you go toilet too. You stop the roselle. Eat morinzyme and morinzyme and richelieu daytime. Mix roselle at daytime, stop at night time, then you'll be okay. My lips are peeling due to using the mask. It is painful and cracks. What is the done before usually deal? Very simple, you apply the Gano oil before you wear the mask. Apply the Gano oil all over the area, not too much, just apply it, then wear the mask. Because the mask is actually, you are reversing your oxygen balance back. Your carbon is reversing back. So anything come back, your what inhale, it come back again, it's stuck inside this area. So it might, the bacteria that comes out actually is trapped inside here. It's supposed to be out to die in the open air. But when it's stuck here, it can impact your things. Okay. So you apply Gano oil, it should be okay. Okay. Gano oil will help that part. Okay. Hypnosis can help you to stop you from smoking. Hypnosis can stop you from smoking. It's the unconscious mind that need you to be reprogrammed. I tell you, if you don't like, you will throw everything. If somebody hate you, you will hate it them so long. If somebody make you think worse, it become you. I don't want to become friend with you. Then you until you die also you don't want to become friend. It's all your mind one. Whether you want or don't want is depend on your mind. Nobody can help you. You hypnosis, I change your mind, then you reprogram back. Then next day morning, the friend is giving you, offer you a cigarette, you still pick up. So it's all come back to your own breath mind. That's why I tell you, if I give you a poison, short life poison, you don't want. But I put all this poison into a cigarette, I give you, you smoke. What is the difference? Okay. What is the difference? You have to see the poison in a real view. Then you know you are taking a poison rather than you are smoking. So you must program that thing into your brain. Then you will change. Okay, then you will change. Then you must, every time you smoke, let's your kid is dying. You must think that your kid is dying because you are smoking, not you dying. Your kids is dying, your family is dying, your wife is dying because of you smoking, because third party smokers. Okay, you must think that, not only for yourself, you must think environmentally. If you think you only dying, doesn't matter lah. Why you are, but you must remember, you're not dying yourself, you are killing your whole family. Okay, think that, then you will stop your smoking. Okay, what else? This one already answered. Doctor, is there any chances that autism kid could be cured using a DXN product? Okay, autism kids, actually the brain is already imbalanced. You can improve them a bit, but you cannot cure them into a perfect kids. No. Okay, I never see that. But I can see a lot of improvement on these kids. Some children cannot talk, can talk. Some children hyperactive become less active, reduce active. Some children cannot do work, now they can do something. So these are the changes that we can help them by improving their brain system, by giving all this holistic medication. Okay, improve their nutrient, improve their immune system, improve their vitamins and minerals to make the system at least function back for their standard of life. You want to convert them into a proper normal people, it's very hard, because this problem is two things. One can be happen due to pregnancy time, development of the baby itself. Second thing, lot of research papers I read is due to vaccine also. The vaccine they pump into the baby. That's why a lot of babies until 1 to 2 years, they are okay. In 3 years, 4 years, then they found the children is autism. They mean in 2 years time, you are giving vaccine to the children. This is based on the research paper I read. That's why a lot of country against the vaccine, children vaccination. So how true it is, we're not sure, because a lot of mercury has been used for the children's purposes. This is not a conflict, but you can go and research yourself in a lot of research papers that why vaccination has been what do you call, a lot of groups, even though doctors and specialists, they argue with use of vaccination, too much of vaccination to children. Not all vaccine, some vaccine are good for children, but some vaccine is like overloaded to the children. It can be due to that also. So that is very subjective and we have to see things. But if due to some kind of vaccine issues, might be there's a chances to take, but you must take it earlier, as early as possible. Not until the kids become 12 years, 13 years, then we want to treat them. Then I don't think the system can be reversed back. Okay, but maybe in early stage, maybe there's a chances since they are born. This is why by giving DXN product from the day one the baby born, it actually help the baby to remove the toxin from the unusual item in the baby's body. Okay, for example, RG and GL can give to the baby born. Okay, lion's mane can give to the baby born. You can give to the baby since the baby is born. GL you can give, keep on giving. From the day one born, keep on giving. So you go bring to injection, whatever it is, unwanted mercury or unwanted system from the vaccine. It will be removed from the toilet and the urination from the baby. And it won't attack the baby. Because it is proven that GL ganocilium has been proven to remove the toxin from the human body. It is proven. It's not one or two research papers talking about it. We are talking about 100,000 papers that have been published all over the world by universities, by research pharmacists, by specialists, by professors. Okay, so if one person only come out, we can say there's something wrong. But 100,000 papers has been research papers come out. You cannot complain anything about the product at all because the research paper is no joke. It's not a simple papers, journals that can publish easily. Okay. So I think the question is almost completed. Correct, Selena?
Yeah, Doc, completed already, Doc.
Okay, now what's the time now? Oh, 9:40 already, yeah. So we can open to the floor for 10 minutes, see how many, anything just left out, we can just top up, see what we can help out. Anybody
Doc?
want to know about any questions?
Yes, Irene, go ahead, Irene.
Doc, for darah beku, because one of my auntie asking, she said the doctor said she got darah beku, then the doctor give her everyday injection.
The injections are temporary only, it won't work much because 24 hours the injection go out from the body. What injection they're giving? Vitamin?
Don't know, he just said injection.
Never mind. What you can produce to give him, give her, you can suggest her Cordypine mixed with GL powder. Okay?
Okay.
Cordypine mixed with GL powder. Okay? Androgy 1 capsule 3 times and Rosel tablets 5 tablets 2 times.
Okay. She's now in Kuching lah. I already asked my auntie Susan to bring her to check her eyes lah.
Okay.
Maybe she will arrange lah, I think.
But it will help her to balance the body. Then slowly we can see the improvement and she no need to keep things. But if they too thick mean they normally give warfarin. Did she is in the warfarin?
I don't know.
Okay, never mind. You can get all the info. Just WhatsApp me. See what we can do for her, because we need to see history of treatment and what she is going on, what kind of condition she is, and why she is taking that medication for what kind of condition. Also, we need to see either heart problem or any other bleeding or blood thickening or damaging the blood vessel. We are not sure yet. We have to see that clearly. Then from there we can advise her properly. Okay. Okay. Thank you, Irene. Anyone else want to know about any questions? I think today is too many questions. It's okay. We have 2 hours and almost every 2 weeks once. Then we can share a lot of questions and everybody will learn something out of it.
Doc, you can stop recording now, I think, Doc.
Oh yeah, okay, I can stop recording.
Yeah.
Let me